If you have a class 2 orthodontic patient and you want to correct the class 2 as well as the overjet, here's how you can do it with aligners and class 2 elastics. Now, two things to keep in mind is one, I would stick to only mild class 2 cases, so somewhere between 1 to 3 millimeter class 2. And number two, the curve of speed, which is the deep curvature of the lower jaw. If you level that, that's already going to correct about 1 to 2 millimeters of class 2 usually without even having to use class 2 elastics. So whenever you're tackling a class 2 case, you look at the curvature of the lower arch first and work on leveling the curve of speed before you even start a class 2 elastics, because you might be surprised if you just have 1 to 2 to 3 millimeter class 2. By leveling a curve of speed, you may correct all of the class 2 before you even have to use class 2 elastics. So let's just use an example case from the Invisalign Global website where they have some example cases. So here's a class 2 case. As you can tell, this patient has, it's kind of hard to see, but probably about 3 millimeter class 2, and they have some excessive overjet, and this is what the case looks like afterwards. And let's look at how they did this. If you look at the patient's self, you can tell that they have excess overjet and they actually have a deep curve of speed as well. So this is what I'm talking about. If you level the curve of speed, you're going to correct a lot of these class 2 and excessive overjet already. So what they did in this case is they added some buttons like right here on the lower molar, as well as on the tray on the upper canine area, and they added class 2 elastics. They also had some added buttons here, but that was only for vertical elastics and not so much for the class 2. This button is for the class 2 correction, as well as there was a hook placed on the tray on the upper arch as well, and this is kind of like what it looks like from the frontal view. This is actually a better indication how to set this up. You have a cutout or a button on the canine area on the upper arch, and then you have the button on the lower arch with a relief on the tray as well. So you can run a class 2 elastics that's going to move the jaw forward and correct the class 2. Now, same thing on the other side, because you need to keep the same on both of the side. Now, one of the problems with class 2 elastics is, one, it can dump the lower teeth forward, so you get some proclination forward, which is actually not something that's desirable. And the other problem with class 2 elastics, if a patient has TMJ problems, then you shouldn't use class 2 elastics. Now, the case finished very nicely, and they corrected all of the class 2, which, remember, this patient had about 3 to 4 millimeter class 2 at the canine, probably about 3 at the molar, and they finished with a very, very nice case. Now, let's look at the ceph. Now, if you look at the ceph, they also corrected the overjet. This patient had this excessive overjet, and they leveled the curve of speed. But one thing they did get some extra protrusion of the lower teeth, which a lot of times could result in some recession, although this case looks really nice. You just have to be really careful with this. Sometimes you have to do a little IPR here to prevent these lower teeth from dumping forward. So hopefully this was helpful if you have a class 2 clear aligner case and how to use class 2 elastics. If you have any questions, we do have an orthodontic mini residency where we teach general dentists as well as pedodontists how to treat these cases successfully with both wired braces or straight wire braces as well as clear aligners. And we also cover TMD, sleep apnea, and myofunctional therapy. If you have any questions, just post it below this video.